most of the women are facing is irregular periods. Okay, so that too, it has become very common after the pandemic. So let's see about irregular periods today. So first of all, what is a irregular period? Okay, so a regular period is the one which comes like anywhere between 21 days to 35 days. If you're getting your period, then your period is regular. Okay, and especially if you are getting it from a very varying value, like this month you are getting 21, next month like 25, another month you are getting like 35, then that is considered as a irregular period. Okay, and there are several definitions for this. And most importantly, if your period cycle is going beyond this 35 or less than 21, you are into this irregular period cycle category. Okay, especially if you are trying for pregnancy, what I will recommend is like the cycle between 27 to 35 is like well and good if you are trying for pregnancy, because luteal phase length is really important. First and foremost thing is stress. Okay, so stress is like for everyone. It can be an exam stress, it can be a love breakup, okay, whatever it is, financial breakdown, whatever. So stress will alter your hormones, it will affect your HPO axis, hypothalamus, pituitary and ovarian axis. Okay, so stress will have an impact on ovulation, on your hormones, so that it will alter your hormones, so you'll end up in having an irregular period. This is one thing. Next one is like sudden weight loss or sudden weight gain. Okay, another thing, recent condition, disease. Okay, if you had any particular illness, for example COVID, okay, typhoid or whatever. So if your body has undergone some kind of infection or disease, of course there might be a change in your hormone. Okay, this might alter your hormone, your illness, so that you'll have an irregular period. Even I have faced this after COVID. Okay, then lifestyle, poor lifestyle. Okay, lack of proper sleep, and then too much of alcohol, smoking, drugs, something like this. More of junk food, eating food not at the proper time. Okay, skipping breakfast, skipping lunch, something like this. Okay, all these comes under this lifestyle. Sedentary lifestyle, especially like lack of exercise, work from home has made the sedentary lifestyle to the top. Okay, so you can just move your body for every 30 minutes daily. Of course, this will prevent you from this irregular period, and not only with this irregular period thing, it will prevent you from several other things like obesity, cancer, and many things like this. Okay, so sedentary lifestyle is also a cause for irregular period. And things like breastfeeding mothers will have irregular period because of the hormonal changes, and menopause mothers, okay, those who are into this menopause. These are the common things that cause irregular periods, and conditions like PCOS, endometriosis, fibroids, these things will also cause irregular periods. Just wait for like 2 to 3 cycles if you're facing an irregular period. Okay. Meanwhile, try what are the things you have to do at home, like lifestyle changes, be physically active, take good proper food, sleep at proper time, everything. And then, especially if you're facing more pain during your period, if your period is like really heavy when it comes, if your period is like really scanty or light, if the color of the blood is like really a different one, like very light pink or something like brownish throughout the period, okay, starting and ending, if you're having a kind of little dark brown, that is totally fine. Okay, but if your entire period, if you're bleeding for 5 days, all these 5 days, if you are facing an extreme dark brown blood, or if you are finding any kind of if you're having a prolonged period that is more than 7 days, some people will have like 15 days, 16 days of period. Okay, so if you are facing anything like this, it's a time to visit your doctor. A woman is having a irregular period, she might also get frequent headaches. Okay, she might experience more of PMS, premenstrual syndrome, like a kind of nauseating feel. Okay, and loose motion or constipation before and during periods, and then severe weight gain or severe weight loss. These are the other things that is associated with irregular period, and it also has an impact on your skin health. Okay, people will have hormonal acne if they are having irregular period. There might be so much of hair fall. We'll be noticing it during these days. actually for young or new menstruators, it is very common to have irregular periods, especially in the first or second year till 2 years. Okay, this happens at times because of heredity, and another thing is their cycle, their hormones have just started. Okay, so it might take some time to regularize. So it is very common. If you're finding it difficult, of course, you can visit your gynecologist. Birth control pills will not work, will not address the root cause. Okay, so this is a large myth, and this is like widely spread. Using birth control pills will cure your irregular periods. No, it's not true. Okay, it can lessen the symptoms of irregular periods, associated symptoms, but it will not address the root cause. Okay, so that is the thing. If your irregular period is because of insulin resistance issue, okay, so you might get PCOS because of several things. One is like insulin resistance. So if it is related to that, at times metformin can work. Okay. So doctor will give you the proper answer for this, but birth control pill will not cure your problem, but it will not address the root cause. Okay. So the thing is, no single magical pill, and then no single magical food item, no single magical exercise will cure your irregular period. Okay, you have to always address the root cause. Your tablets, if it is like associated with thyroid, okay, so because of hyperthyroid or hypothyroid, if you are getting your periods like on 45 days or on 60 days once, okay, so that will work. If you are addressing your thyroid issue by taking pills, okay, that will work. It is a lifestyle issue. So when you are improving your lifestyle, okay, definitely that will be a good change when you take proper food item, especially less carb and more of protein and good fat rich foods. Okay, more fruits, vegetables. These days we are into there is a saying like you have to eat very less amount of rice and you have to eat more chapati and all. It's not like that. Okay, rice is our staple food. Okay, so you can have rice. But the thing is, you have to choose your rice properly. Red rice, brown rice, and all, it will definitely help. And if you are going for meals, you can prefer doing it in half, like hand pounded rice or half polished rice. Like fully polished rice will have more of glucose in it, so it will not have more of the micronutrients. So go for semi polished one, and then traditional rice varieties like brown rice or black rice, then and there you cannot have it regularly on a daily basis for meals and all. So for meals you can go for semi polished or hand pounded rice, and for other things, okay, for making idli dosa batter and all, we can prefer this brown rice or black rice, something. Okay, so no need to avoid rice completely. It's actually a superfood, okay, when you take it properly. Next one is like more protein. Your hormones is made up of protein, so include more good protein in your diet. Okay, and avoid having too much of broiler chicken, too much of milk, because these days these milk are more hormonal. Okay, they give this estrogen injection, so that's why like a cow that gives 3 liters of milk today, it is giving like 15 to 20 liters of milk. It is more hormonal. Same applies to broiler chicken. Try to limit broiler chicken and try to limit products that are made up of MSG, monosodium glutamate. So avoid junk foods. You can have it occasionally, enjoy your life, okay, but it should not be like a regular practice. So these days, actually, a proper diet has become something very, what to say, very fancy one, but eating unhealthy has become new normal, okay. We have to correct it.